Hello everyone, I hope you all are well and keeping safe from the coronavirus. I'm Winnie Monyiga from Kenya and I'm Kenya's Smart Food correspondent. Today I would like to talk about the impact of the COVID-19 pandemic in Kenya. The COVID-19 pandemic has affected several areas and sectors in Kenya, which has disrupted the general livelihoods of people. Agriculture is not an exception of the sectors that have been highly affected by the pandemic, and it's important to note that agriculture is the backbone of Kenya's economy and plays a major role in ensuring food and nutrition security of the population. In Kenya, agriculture is mainly carried out in rural areas, and the people carrying out the farming are majorly the elderly, who are right now considered to be highly susceptible to the coronavirus because of their compromised immune systems. Therefore, despite the Minister of Agriculture urging them to continue producing farm products so as to ensure food security, most of them are not up to the task because of the threat that the coronavirus is causing to their safety and health. Secondly, there have also been ongoing internal restriction of movements in some areas, which has caused a strain for the farmers' ability to access markets to sell their products and also purchase farm inputs. The local markets and stores have also been closed, and the supply chains have been restricted due to quarantines, sick farmers, sick drivers, sick sellers, border closures, and trade restrictions. In this case, the large-scale producers of farm products like poultry, milk, and other fresh produce have been forced to scale down their production because of the accumulating farm losses in their fields. The reduced income of the farmers has limited them to also hire farm laborers to assist them in the production, and it's important to note that the farm labor has also been restricted because collective work has been banned in the fields. Attendance of farmer field schools has also been, and also the agriculture cooperatives cannot be carried out right now because of the restrictions and the quarantines, and therefore extension services can no longer be disseminated to the farmers. There's also labor shortage in processing and production of food products and supply. Hence, the prices of the common foodstuffs has increased drastically, and this implies that with time, overall production and availability of food will be highly affected in the country, and Kenya is risking a looming food crisis. Due to the pandemic, the government has diverted most of the funds to fight the coronavirus pandemic, and less attention has been given to illnesses such as HIV/AIDS, whereby the patients suffering from HIV/AIDS have been relying on the provision of ARVs from the government. Also, before the pandemic, we had a locust invasion which had destroyed millions of arable and pastoral land, and right now the issue has been set aside. We don't know how much the effect of the locust has gone, which can also be a potential or is already a food security threat. The economic activities have also been restricted due to the curfews, and most of the people have lost their jobs because of the shrinking economy. Some of them are also facing pay cuts and unpaid leaves, which has also affected their purchasing power. And the poor societies, especially those in urban areas, can hardly access food and the basic needs because casual jobs are no longer available at the moment. Job insecurity having affected the purchasing power of the vulnerable individuals, there is change in eating habits because they can no longer access the diverse diets and thus cannot also get access to nutritious meals. Also, due to the social distancing and quarantine, there's less traffic in hotels, and most individuals working in hotels are losing their jobs, and also the hotels are facing high losses. The social life and generally the culture of the people has also been disrupted because cultural events and religious events cannot be attended, such as weddings, Sunday church services, Friday Islamic days cannot be attended. Right now, people are in Ramadan and people cannot go to the mosques. For those who are losing their loved ones, they cannot carry out a proper burial ceremony for their people. And The stay-at-home directives have also been noted to be leading to other social problems such as domestic violence, which is also a big problem. Millions of children are already missing out on school because the schools have been closed, and despite the fact that the Minister of not Agriculture but Education is urging the students to carry out virtual online learning, it's not viable in rural areas who lack electricity and access to the gadgets that can support the initiative. Therefore, they are also having a challenge in their education, and for those who are about to carry out their national examinations are really facing a challenge at this moment. In some areas, the children who are going to school used to rely on school meals, but right now, since they are no longer in schools, they cannot afford a proper meal, nor can they access nutritious meals. There are other problems that I've not highlighted, but I believe are also affecting the general livelihoods of the people, and therefore I would like to comment that the government of Kenya, as well as other affected African countries, mobilize efforts to mitigate the effect of pandemics like COVID-19 and also build resilience in case in future we get to face a pandemic like this one. Thank you for listening. I hope you also continue keeping safe and protect yourself from the coronavirus. Thank you very much.